Welcome, everybody. My name is Jill Jonathan, and I'm with Red Wine and Blue. We're a community of women who use digital media and friend to friend organizing to change the world one suburb at a time. One way we do this is through conversation. So today we are having an incredible conversation. Jojo from Jers is here, of course, and then we have two special guests, Amy and Charlotte, who are staff members with Red Wine and Blue. And we asked them to join us because, as a lot of us know, October is what's called Breast Cancer Awareness Month. But as I have talked to Amy and others, we're already aware. Okay. So let's move from awareness to action. Let's take some action. So I'm excited to have these ladies join. And Amy, let's just start with you. Can you just give us a little bit of your story with breast cancer and why this is important to you?
Yeah, absolutely. Well, thank you so much for having me this morning and taking some RWB time to address this, because it is the reason why I'm here. I got very involved in advocacy and volunteer work after my breast cancer diagnosis, but I had no family history of breast cancer. I had an aunt who ended up having stage 0 breast cancer many years ago, and it was at the time that they were changing guidelines for treatment, and they were going to go ahead and they were recommending that everybody be tested for genetic mutations to help guide them in what kind of treatment plans that they would develop due to the identification of multiple genetic mutations that increase individuals' likelihood to develop breast cancer, but as well as other types of cancer. And very surprisingly, hers came back positive, and we were all kind of blown away that we had this kind of gene hanging out in our family for all these years and none of us knew about it. I had thought that I had time to kind of deal with it. I did get testing and I found out that I was a carrier. And so that meant that I had a lifetime risk of 80% chance of developing breast cancer. And so I was pregnant with my third child at the time that I found this out, and in my 30s, and I thought I had many, many more years to kind of make decisions as to how to deal with this. But unfortunately, I found a lump when I was still breastfeeding my third child before she turned 1 year old. That week, I found out that I had aggressive stage 2 breast cancer with several tumors in one of my breasts. And so changed the whole trajectory of my life, changed my career, changed my whole outlook. And that's why I'm here today doing the work that I do.
Thank you, Amy. And Charlotte, what about you? What's your story?
Well, I was diagnosed last year, and in fact, it's about 1 year since I started chemo. My mom had breast cancer, and I was her caretaker during that time, so I already had done a lot of studying about it. But I was breastfeeding, and I didn't feel a lump. In fact, what happened in my story was that I had a pain in the center of my chest right here, and the doctors kept telling me it was a tension pain and that I couldn't get a mammogram until I stopped breastfeeding. And I thought, of course, I thought I had plenty of time. So I kept breastfeeding, and it got to the point that it was waking me up at night. So I went to a walk-in clinic, and at this point, my son was much older than I thought, as I breastfed a really long time. And the doctor said, well, at this point, I feel like, you're almost 43. It probably makes more sense for you to go ahead and get your first mammogram since your mom had breast cancer than it does to continue on breastfeeding. I don't think it's cancer, because cancer normally does not hurt you. Well, the doctor said, you have to make an appointment 6 months after you stop breastfeeding. And I went ahead and made it as soon as I got home. And 3 months later, I had my first mammogram, and that's where they found it. And one of the things, as you mentioned, Amy, that I think is so important is for people to recognize that when you are breastfeeding, you can get a mammogram. You don't have to wait 6 months. And I see so many people who come into this, what time in your life do you want to live forever? The most in your life is like when you have a baby, because you see them and you want to see them grow up. And I hate to see people who are breastfeeding and their doctors tell them they can't get mammograms, and then they find out later on and they wish they had gotten it, a little bit earlier. So that's one of the reasons I got involved in advocacy. And yes, breast cancer did change my whole life. I was lucky enough to be in a good place where I could sort of reassess what mattered to me and where I wanted to put all of my energy to the things that mattered to me in my life. And that's how I ended up here at Red Wine and Blue, and also as a breast cancer advocate.
Thank you, Charlotte. And we're happy that both of you are here. And Joe, I just want to turn it to you if you have any questions as well.
Yeah, I think it's absolutely fascinating. We all have our whys, for why we chose advocacy. I think it's so important that you're both doing this because a lot of women don't have all the information and they don't listen to their bodies, or their doctors maybe dismiss, what's going on with them. So I'm just curious, what are some of the things that you would say to women who maybe aren't paying close enough attention? What are some steps that, I could take every day that I can make sure to be aware of what's going on with my body, and, make sure that I'm keeping track of whether or not, I need to worry about something or go to the doctor, et cetera, just preventative, or, the kind of attention to these sort of things that you would recommend.
I just want to highlight what Charlotte was saying. And I think that Charlotte's story, and I have multiple stories that I can tell about moments during my own treatment, my diagnosis, that I had to truly dig in and advocate for myself, is I think that this runs deeper to the greater issue of women not being believed, being brushed off, being gaslighted as to what their symptoms are, being told they don't fit into some sort of box. And for physicians and for the greater medical community to not be on top of the fact that, like, yes, you can have a mammogram when you're breastfeeding.
Mm-hmm.
You can have an ultrasound when you're breastfeeding. You can have an MRI when you're breastfeeding. However, it falls out of the normal parameters of kind of everyday life. And most clinicians are not aware of this. And so women under the age of 40, women still in childbearing years, have highly aggressive breast cancers compared to the standard norm of those over the age of 60. And the medical community is not well suited to understand the unique needs of diagnosing, managing, and treating younger women who are diagnosed with breast cancer. And so while it is still rare, like, I think we're like less than 3% of all breast cancers diagnosed are under the age of 40 at the time, 45. You have to advocate for yourself. You have to say, I am not putting this pain off for another 6 months or a year.
Yes.
There has to be a way that you can treat me as a woman.
Mm-hmm.
And it's just shocking to me to continue to hear stories of women being blown off and not receiving inexpensive, simple diagnostic treatment or tools because they're in childbearing years. So
Yeah,
advocate for yourself.
Yeah, I mean, that's what I took too, Charlotte, when you were telling your story of the doctor just kind of brushing you off.
Mm-hmm.
How did that make you feel? And what do you think you've learned from that experience?
Well, I think I thought she said that my breast tissue was just too dense, and I just took her for her word.
Yeah.
And then it wasn't until later, after my diagnosis, that I thought, I wish that I would have just gone ahead and insisted on a mammogram because they could have caught it earlier. And when I meet people now, for instance, I started a breast cancer support group, and 2 of our new members are still breastfeeding, and they had to stop breastfeeding in order to begin their treatments. So I thought to myself, obviously someone is taking these people seriously. Why wasn't I told that I could have those? And I feel like everyone needs to know that they can ask for those treatments. They can ask for those diagnostic treatments. So I think there's a lot of things, especially within the cancer community, that you can only learn from other cancer patients, and that doctors, because they are separate, they don't understand some of the things that we do. And I wish that there was more advocacy with actual patients that could speak to you when you had a diagnosis, and that could help you in so many ways. In fact, that was one of the reasons that I wanted to create a breast cancer support group locally, so that we could talk about all the doctors and the treatments and the things that were available in our city, not just, internationally. I think it's so valuable to talk to someone else who's been through it, because they can tell you things that no doctor knows. Even the oncology nurses don't know. But I will say this: if you ever want a tip, you ask the oncology nurses, because they know almost everything, because they've seen us all. But I feel like the oncologists are still kind of separated from this, and the same with the doctors that do the diagnosing, or that order the tests. But as Amy said, I absolutely agree. Advocating for yourself is something that I learned, begrudgingly throughout this process. But I think that it's so important, and I also think it is such a shame, because I would tell people to listen to your body. If anything is bothering you, you go to the doctor. But you don't want to get labeled as the person who they think is there too often. But why does that exist? I feel like there's nothing wrong with going in and saying, you know what, I'm nervous about something happening in my body. Let's check it out. There should never be a part in any file or notes of a doctor where they could label you and begin to not take you seriously, in my opinion.
Yeah, I feel like as women, that's one of the things. It's like, as women, we're like, oh, well, I feel guilty, I feel bad. We don't want to be that person. But we all know a man gets a cold and he's basically like, shut down for a month. I wanted to just comment. It's not really a question; it's a comment more on the fact that you didn't necessarily have this community for yourselves when you were going through all of this, but you're creating a community for others, and I just think that's so incredibly important. And must be like fulfilling, I'm sure.
Well, I feel like for all the things that I went through with this process, if I wasn't able to turn it into something positive or helpful for someone else, then it wouldn't be worth all of the trouble that I went through. Of course, my life is worth it. I'm glad that I'm here. But I also really want to help other people through this. It's a tough thing to go through, especially when you have questions and you don't know who to ask. I think it's so important to have community.
I called it post-traumatic growth.
I like that.
Yeah, I do too.
And Amy, I know I learned so much from you last year, because we talked this time last year about breast cancer awareness and changing the mindset and the language of breast cancer action. And so can you just touch on a little bit of what do you mean by that? Like, those two words are very different, and just tell us like why it's so important to shift the conversation to action.
Yeah. We had this conversation, so I'll try to just do like the broad strokes, but Breast Cancer Awareness Month was born, really the genesis of it was in the 80s. And that is right after the 1970s, where standard of care mammography became a part of our treatment plans. Like, everybody got an annual mammogram. And so it moved cancer and talking about women's issues out of the shadows into the forefront to raise awareness about breast cancer, getting mammography, because this was brand new to the US population. And while it was a critical component to the education of the society at that time, there's a time and place for everything. And I think for me and the breast cancer community, we think that awareness has passed. It is a component of Breast Cancer Month, but it doesn't need to be the whole shebang. And what we need action, because breast cancer is a devious, relentless disease, and no breast cancer is alike. And we are seeing more and more younger women being diagnosed with it. And so everyone is really on the bandwagon with awareness and early detection, but we really need to swivel, pivot, and focus on lasting impacts of breast cancer treatment. Why are we continuing to give breast cancer? Why are we not determining why some women are treated with breast cancer and then go on to develop metastatic disease despite doing all of the standard of care? Why do Black women die disproportionately of breast cancer and are diagnosed with more aggressive breast cancer than women who are white women? And we have a lot in our society, in our legislature, how our healthcare is structured, that we're all about finding the breast cancer. But we really need to focus on, what do we do after we find it? How do we treat these people and support these people to live with essentially what's going to become a chronic disease moving forward?
Mhm. That's so important.
I'm just looking at the differences by race and ethnicity, and I don't think we have that conversation nearly often enough. I wasn't even aware of the disparity here.
Yes. And I mean, if we want to talk about how policy and how breast cancer is a political issue, there was a wonderful study that came out last year, and it looked at Medicaid expansion in the states that participated in Medicaid expansion, which I'm sure all of us have heard all the drama about the states that don't want to expand Medicaid.
Mm-hmm.
Giving individuals access and covering up like those basically gaps in care actually reduced and eliminated disparities in breast cancer for Black metastatic women. Wow. Because they actually had access to care. And so we can make changes and improve people's lives and address systemic racism built into our healthcare system and in our society at large with really simple policy changes like expanding Medicaid.
And Amy, Charlotte, jump in too, but Amy, what kinds of things are you doing, or what kinds of things can we do to make that happen?
Charlotte, you want to take this?
Sure. Well, the first thing you can do is connect with everyone that you know and remind them, number one, that they should always advocate for themselves, to check themselves frequently to the point where if anything changes in your breast area. Number two, tell them to share with all of their friends how important it is for them to support the right candidates that will also support Medicaid expansion and reproductive rights. Because when I was diagnosed, I remember thinking to myself as Roe was overturned, how I cried, because of course, I think a lot of us did. But one of the reasons was because I understood it from a different perspective all of a sudden. I understood it from the perspective of somebody who had recently been diagnosed with cancer. And I thought to myself, thank goodness I'm not pregnant. What would I do? What would I do? And how would I be able to make that decision? And how much worse would that make that for me to not be able to know whether I could go in and decide whether I could have a treatment or not, whether I could think about parenting my child, hopefully, and surviving for the future, or not being able to do that and giving birth to another child and leaving my partner and my other child alone. It's so important for us to be able to make these decisions. And it's one of the reasons that the work we do here is so important. I could go on and on about that forever. I have some other areas of advocacy that concern me, but I would say the only other thing that I really feel like I like to focus on is just community in general. So as far as breast cancer goes, when I had my diagnosis, the way I found out, I'm very thankful that the people before me came and released our records digitally. So there was like the e-patient movement that demanded that we got our digital records. Well, the digital records, I got my digital records, and I was very thankful that I was able to send them to different doctors so I could get second, third opinions. The issue is this: the way that I received my diagnosis was through a lab report. And I couldn't reach anyone when I called to make an appointment to talk, or when I called to talk to a doctor, I just called schedulers. And they said, well, you're scheduled to talk about this in 2 weeks. And this happens. Yes, this happens almost every day now with all kinds of people. Luckily, I am savvy enough that I could figure it out and use resources that I found on the internet, the appropriate resources. I'm not sure everyone can do that. So another thing I would say is if you really want to follow this issue closely, then you will also follow your candidates well enough to know what their take is and how they want to support the hospital systems and the healthcare systems in advocating for more support, more therapy, more resources towards oncology. That's it.
That just makes me think, when you hear people who are like, I'm not political, I don't pay attention to politics, it doesn't affect me. And this right here, I'm like, do you have a body?
Yes.
Do you need medical care? Then
Absolutely.
It does affect you.
Yeah, as Rachel says, you might not do politics, but politics does you. I mean,
yes, exactly.
I always think about that.
Mm-hmm.
Well, you can avoid it, but it doesn't avoid you, as you said. I mean, you have to make the appropriate decisions when it comes to having your voice heard, or, you'll find yourself in a situation where you have no control and nobody wants to be placed there.
Yeah, exactly. And Amy, on Facebook a few days ago, you made this really short, easy to understand video with an action that everybody could take by calling your senator and your representative. So can you just share that with us? Because I saw that and I was like, well, I have a couple minutes, I can do that. And I was like, oh, that was so easy. So just, share that with us, what we can do.
Yeah. So piggybacking off of what Charlotte said, absolutely know who you're electing. And they have to be individuals who support expanded access to care, want to support the ACA, and expand Medicaid. There's also this whole discussion of the insolvency of Medicare and Social Security, and what are we doing about that? And I think something else that a lot of people don't realize that I wanted to highlight: everything that's going on with the Speaker of the House. There's no laws are being passed. No change is being made. I've been working on federal legislation for the metastatic community for years now, and we have been working hard to get this bill passed. We know that nothing's happening right now. And so at every level, from huge structures of the government shutting down all the way down to maybe a few thousand metastatic breast cancer patients this year, are not going to get benefits that they deserve because of the dysfunction at all levels of our government. And so, unfortunately, we don't have the privilege to not pay attention, because literally the lives of each other and ourselves are on the line based on who is making laws in this country. And so, people ask me all the time, well, what can I do? Well, what is pinkwashing? Who should I donate to? Donation is great, and we need money for research, 100%. So find a really great organization that you can donate to for metastatic breast cancer research, because metastatic breast cancer is the only cancer that kills. And I personally would hope that we figure out how to cure that, or how to make it no longer lethal, and then we can start chipping away at the rest of it. But call your representative. You can go to stopbreastcancer.org, and you can look up who your two state senators are, who your representative is. And this is the organization that I advocate for as a volunteer. I'm the lead volunteer for Ohio with the National Breast Cancer Coalition. And we've been trying for years to get the Metastatic Breast Cancer Access to Care Act passed. And what people don't realize is that when you are disabled and apply for Social Security disability, once you are they're like, yes, you get it. They're like, well, you have to wait 5 months for Social Security disability. And they're like, and also you qualify for Medicare. Well, Medicare is for those individuals who make too much money, so they don't get to have Medicaid benefits, but they don't have enough money to buy on the open market because they've lost their job because of their disease. So you get to get on Medicare early under the age of 65. It's a 2-year arbitrary wait period for that. So you've just been diagnosed with metastatic breast cancer. You have to leave your job for treatment. You've made too much money, so you don't qualify for Medicaid, but you can't go broke paying for on the market, open market healthcare. So they're like, great, you can have Medicare. Wait 24 months for it. It's cruel.
Yeah.
And it is unbelievable that this still happens. And so call up your representative and say, I want action. I want us to support people living with this disease and do meaningful changes in our policy so that we can help these people live with lives with dignity and not go broke. So that's what you can do. Take 3 minutes, call them up, say, please support this bill. We want action this month. We're tired of awareness.
Yeah. Thank you, Amy, for sharing that. And you mentioned something briefly, pink washing. I just want to touch on that for a minute for people who might not know what that means. So either Amy or Charlotte, if either one of you want to jump in and tell us what exactly is pink washing.
You go ahead, Amy.
Pink washing is the for-profit monetization of products, services during Breast Cancer Awareness Month that gets corporations money in their pocket, and it does not truly benefit the breast cancer community. And so during the month of October, we see pink everywhere. And they know that psychologically it pulls on our heartstrings. It makes us think that we're doing something. It makes us feel a little bit good for a moment as we stand at the cash register and maybe grab that pink covered, chapstick or whatever it is. And really very little funds, if any, sometimes actually go to reputable breast cancer organizations. And so I don't personally buy anything with pink on it, ever. I'm not going to walk around with a pink shirt on. I'm not going to buy pink socks. I'm not going to get anything pink because I'm not going to give my money to them. I'm going to give it directly to the individuals, organizations that are doing the good work. And I'm not going to funnel a cent of that to another organization or company.
Absolutely. Use that money and donate it somewhere that it matters. So important.
Charlotte, do you have any favorite organizations that you would recommend?
Here, I like Living Beyond Breast Cancer as far as a national or nonprofit, and then any local ones. Local is always great. Oftentimes, if you just check your Facebook, you can find groups that are local. Small groups that are upstarts, especially, are especially helpful most of the time because they are actually giving that money directly to people. Mm-hmm. So I think sometimes in the larger groups, your money kind of gets lost. So you want to know that you're doing the most with the money that you're giving people.
Yeah. And Joe, before we wrap up, do you have any other questions?
No, it's just a comment, really. I had no idea about the pink washing. I confess, I had no idea. And I think I pay attention to stuff, and I had no idea about that. That's one of the things I love so much about this community, Red, Wine, and Blue, this community, that I have an opportunity to talk to women like you, and our community at large gets to listen to, your stories, and it's enlightening and empowering. And I just think that it's, again, so incredibly important. I learned so much just listening to both of you talk, things I thought I, knew a little bit about and really didn't. And again, this is political and it's not political at the same time, but I don't think that enough people realize just how political it is and what they can do. It's not like what we do here at Red, Wine, and Blue isn't just talk about something and then, twiddle our thumbs. You can do something. You can identify a problem and take an action. And we give you all the ways to do that. And this conversation is one of those.
Yeah,
Thank you.
absolutely. And I mean, and like I said, at the beginning, I mean, that's one way we're trying to change the world is by having these conversations and learning from each other. Amy and Charlotte, you both are just complete badasses. So thank you for joining us, sharing your story, and just giving us ideas of how we can take action. Do you all want to close with anything?
Yeah, I don't think so. I think I've said it all. But I think as being in Ohio, I wanna highlight again what Charlotte said. Reproductive rights is extremely important to the breast cancer community. And if you want to support women who are being diagnosed during their childbearing years, 100%. We need bodily autonomy. We have had a woman who was diagnosed with breast cancer last year during the 6-week ban that was in place, and she had to travel outside. You hear these stories of people going through their pregnancy and taking chemo and doing all this other stuff. That is that individual. That would not have been an option for me. That would have not been an option for me. My type of treatment, I would have not been able to be pregnant if I was going to have the best care possible for me. And so think about, we talked about loving your neighbors, supporting your community, believing women, trusting women to know their bodies, to know what they need to do for their families, to be healthy and thrive is the most important thing. And that happens at the ballot box.
Yeah.
Absolutely.
Thank
And
you,
I would-
Amy.
Oh, go ahead. Sorry.
Oh no, I was just saying thank you for mentioning that. Ohio people vote on
Vote.
November 7th. So yes, on issue 1. Okay, go ahead,
Yes.
Charlotte.
I was just going to say roughly the same thing. I think reproductive rights are always important. I think that a lot of people believe that these issues, when it comes to these medical issues, are rare. But the only reason they believe that is because people are afraid to talk about it. I know personally several people who had to make terrible decisions after diagnosis.
Yes.
But I'll tell you, they would never tell the world about it. And I urge people to consider that there are so many more people in this world that are not sharing their stories with you out of fear and out of judgment, and to put your own judgments aside and just recognize that just because you haven't been through it does not mean that you shouldn't recognize that there should be a space for a doctor and a woman to make their decisions on their own, and that you should fight for it, because it could be you. It could be your daughter. It could be your best friend. You never know who it's going to be. So you should fight for this. Vote 1 in Ohio for Proposition 1. And in Pennsylvania, make sure to vote for your judges, because if we keep the majority, then we will be okay. If we do not, then our reproductive rights are on the line. And there's nothing worse than being a woman in a state that cannot control what happens to your own body and dealing with a diagnosis. So I urge you to please do everything you can and fight for these rights that we are fighting for right now. Thank
And
you.
Virginia, we're looking at you too, Virginia.
Yes.
It's very much on the ballot, this election. Reproductive rights are very much on the ballot.
That's
Everywhere.
right. Fight for yourself and fight for your neighbor too.
Mhm.
Thank you so much for joining, everybody. Amy, Charlotte, Joe. This was an incredible conversation. And I think we'll just go from there. Take action, everybody. Thank you.
Thank you,
Thank you.
ladies.
Thank you.
Have a great day.